Imagine uh, injecting a highly concentrated serum of your own blood
All right.
directly into, your most intimate sensitive tissues.
Right.
And not to fix a bleeding wound, but to literally reverse the biological age of those cells. Welcome to today's Deep Dives, where we are taking you on a really fascinating intellectual journey.
Yeah, we're exploring what is honestly a complete medical paradigm shift, like
Yeah.
stepping away from that old model where we just treat the human body like a broken machine, where you just patch over symptoms.
Exactly. Instead, we're looking at what happens when you aggressively command the body to rebuild itself from the inside out.
And we are applying that shift to a very specific, rapidly evolving area of regenerative medicine, which is non-surgical aesthetic genital procedures for women.
Right. And we've got a great stack of sources for you today.
We do. We've pulled together clinical protocols, Plastic Surgery Institute FAQs, and some really dense medical mechanism breakdowns from sources like Stat Pearls.
Yeah, to really look at the anatomy and the chemistry of sexual wellness. And we're doing this because we have a highly specific mission today.
You really do.
We're taking all this data, comparing two distinct procedures, the G-shot and the O-shot, to answer a question that sits right at this collision point of structural enhancement and cellular biology.
Yeah, the core question. Can an O-shot be administered on the exact same day as an anterior wall hyaluronic acid G-shot procedure without compromising the stability of the filler?
Right. I mean, to figure out what happens when they occupy the exact same real estate at the same time, we have to really understand the mechanisms of action for both.
Exactly. Like, do they work together synergistically, or does one treatment's biological mechanism just end up destroying the other's architectural foundation?
Let's start with the architecture, actually. To understand if these treatments can be combined, we first have to understand the purely physical mechanics of the G-shot.
Right. Looking at the clinical sources, the G-shot, which is also called G-spot amplification, is it's fundamentally about volume. It uses a hyaluronic acid, or HA, dermal filler, and that's injected directly into the Grafenberg spot on the anterior vaginal wall.
And the procedure itself is notably fast, right?
Yeah.
Like the clinical guides point out that the injection takes about 8 seconds.
Yeah, 8 seconds. It's incredibly quick. The patient is typically in and out of the clinic in under 15 minutes.
Oh, wow.
Yeah, it's a highly localized intervention designed to literally alter the physical topography of the vaginal wall.
Because the goal here is mechanical, right? The injection increases the size, the thickness, and the surface area of the G-spot.
Exactly. It's just simple physics. You create a larger target area to generate more friction, which leads to more physical sensitivity during penetrative sex.
And because it's a physical filler, the results are immediate. Like the volume is in place the second the procedure is finished.
Right. But it is temporary. The sources all agree the effect lasts anywhere from 3 to 6 months.
And that temporary nature is why we need to do a deep dive into the science of the filler itself. The Stat Pearls data breaks down the nature of the HA used in these specific injections.
Yeah, and this isn't the liquid HA you find in like a topical face serum.
Oh, right, because that kind of unaltered hyaluronic acid would just be cleared away by the body's natural enzymes in, 24 to 48 hours?
Exactly. To survive for months, the HA in a G-shot has to be cross-linked.
Crosslinks, the sources use that term a lot.
They do. So imagine a ladder. The hyaluronic acid molecules naturally form these long vertical rails.
Okay, I'm picturing it.
The cross-linking process chemically adds horizontal rungs that bind those rails together, sort of tangling them up.
Ah, so it transforms a runny liquid into a dense, concentrated structural gel.
Right. And that dense gel is highly resistant to chemical and physical degradation.
Because the body's enzymes have to work, exponentially harder to clip away all those horizontal runs before they can clear the material away.
Exactly. Yeah. It provides this very sturdy architectural intervention.
It's kind of like placing a custom supportive gel insert into a running shoe.
Oh, that's a good analogy.
Yeah, like you're instantly changing the physical point of contact.
Yeah.
You're adding structural support exactly where the friction happens, but you aren't actually changing the biology of the foot itself.
Right. The structure is just there holding the space.
But wait, if the body is actively working to break down this hyaluronic acid filler over a 3 to 6 month period, slowly clipping away at the rungs of that ladder,
Yeah.
how does it maintain that physical volume in the meantime? Because if you're listening to this, you might be wondering why the area doesn't just slowly deflate week by week, right?
Making the physical friction less and less effective.
Exactly. There has to be a mechanism keeping it inflated.
What's fascinating here is that there is a mechanism, and it's a biological process called isovolumetric degradation.
Isovolumetric degradation.
Yeah. Iso meaning equal, volumetric meaning volume. See, hyaluronic acid is incredibly hydrophilic.
Meaning it loves water.
Right. It acts like a microscopic sponge that actively attracts and binds to water molecules.
So as the cross-linked filler slowly breaks down and becomes, I guess, less concentrated, water just rushes in to take its place.
That is the exact mechanism. As the physical structure of the gel degrades, its capacity to hold water actually increases relative to its mass.
Wow, really?
Yeah, the water seamlessly fills the microscopic gaps left behind by the degrading filler.
So the area occupies the exact same volume and maintains its structural scaffolding right up until the very end of its lifespan.
Exactly. And at that point, the last of the HA breaks down and the water is simply absorbed back into the body.
So the body just hydrates the scaffolding to keep the structure intact. That's wild.
It's very elegant.
But if the G-shot is essentially renting architectural space for 6 months, what happens when we want to actually own that new tissue permanently?
That's a whole different ballgame.
Right. That requires stepping away from synthetic gels and tapping into the patient's own bloodstream, which brings us to the O-shot.
Yeah, the O-shot takes an entirely different, deeply biological approach to the exact same anatomical neighborhood.
Okay, let's unpack this.
It uses platelet-rich plasma, or PRP, which is autologous.
Meaning it's derived entirely from the patient, right?
Correct. The sources outline the process pretty clearly. The provider draws a small amount of blood, usually just 2 or 3 tablespoons,
Okay.
and that blood is placed into a specialized centrifuge. The centrifuge spins the blood at this massive speed to separate the components based on their density.
Right, so the heavy red blood cells sink to the bottom.
Exactly. And the watery platelet-poor plasma sits at the top. But suspended right in the middle is this thin layer called the buffy coat.
The buffy coat.
Yeah, and this is where the platelets and white blood cells are trapped. Clinics actually often refer to this isolated layer as liquid gold.
Liquid gold.
Because the spinning process concentrates the platelets to anywhere from 4 to 7 times above your normal circulating baseline level.
Wow.
And then this concentrated serum is extracted and injected into the clitoris and the anterior vaginal wall.
I have to pause here because this mechanism, it demands some scrutiny.
Fair enough.
If this blood is already in my body, right, circulating through these exact tissues every single minute of the day,
Yeah.
why does drawing it out, spitting it in a machine and injecting it right back in suddenly turn it into a regenerative super serum? I mean, it's the same biological material.
It is, but in your normal circulation, platelets are relatively sparse, and they're essentially floating along in this dormant, deactivated state.
Okay, dormant.
Yeah, they're circulating continuously, but they are just waiting for a signal, which is usually the exposure of collagen from an injury, to activate them.
So they're just on standby.
Exactly. When you use a centrifuge to concentrate them 4 to 7 times above baseline and then inject them in a concentrated bolus, you are creating this overwhelming density of signaling power in one highly specific location.
So using unspun, circulating blood is like sending an email to a dormant factory, hoping a worker sees it.
I love that, yes.
But spinning it into PRP and injecting it is like dropping 1,000 foremen with megaphones directly onto the factory floor all at once.
And those foremen are equipped with specific blueprints.
Blueprints.
Yeah, platelets contain tiny structures called alpha granules, which function like microscopic payload bays.
Okay.
When that highly concentrated PRP is injected back into the tissue, those payload bays open up and release a massive dose of bioactive proteins and growth factors.
Right. The sources focus heavily on 3 specific growth factors, PDGF, VEGF, and TGF-beta.
Let's break those down.
Yeah, if we break those down, PDGF stands for platelet-derived growth factor. This acts as the site manager.
Right.
Its primary job is to call in local stem cells and macrophages to the area to initiate tissue repair.
And following the site manager, you have TGF-beta, or transforming growth factor beta.
What does that one do?
This growth factor focuses on the extracellular matrix. It signals fibroblasts in the tissue to start laying down fresh, elastic collagen.
Okay, so it's orchestrating the structural rebuild of the tissue itself.
Exactly. And finally, VEGF, vascular endothelial growth factor. This is arguably the most crucial for sexual wellness.
Really? Why is that?
Because its job is neovascularization. It literally commands the body to sprout brand new capillaries and blood vessels in that specific area.
Which is paramount because sexual function relies heavily on vascularity.
Heavily, yeah. New blood vessels mean significantly increased blood flow.
And increased blood flow leads to greater tissue engorgement, heightened nerve sensitivity, and an increase in transudate, which is the body's natural lubrication.
So you're basically staging a controlled cellular intervention.
But because this relies on actual biological growth, building new blood vessels and new collagen from scratch.
It takes time.
Right. The effects are not immediate like the volume we see in the G-shot. The clinical guides note that the O-shot takes time to build, usually peaking around the 3-month mark.
Yeah, but the trade-off for that wait is longevity.
Because you've built new tissue.
Exactly. Because you've built new tissue and new nerve sensitivity, the results typically last much longer, from 12 to 18 months, and sometimes up to 3 years.
That's a huge difference.
It's a true regenerative process. You aren't masking a symptom or just adding a physical spacer. You are fundamentally changing the biological age and functional capacity of the tissue.
Which brings us to the core question you, the listener, brought to this deep dive.
Here we go.
Now that we understand the instant, volume-based HA filler of the G-shot and the long-term regenerative biology of the PRP O-shot,
Yeah.
can these two completely different mechanisms be combined safely on the exact same day?
Looking across all the clinical sources and protocols provided, the answer is yes.
Yes.
Yes. Many clinics actively promote the combined treatment as a comprehensive solution that addresses both the physical and biological layers of intimate wellness.
Okay, here's where it gets really interesting, because I need to push back on the chemistry here.
All right, hit me.
If the O-shot triggers this massive biological breakdown and rebuilding process, wouldn't that completely ruin the G-shot?
How so?
Well, if PRP is dumping growth factors, calling in macrophages, and initiating this aggressive tissue remodeling, it's creating local inflammation to signal the stem cells.
Right.
And inflammation is generally catabolic, right? It breaks things down to clear the way for new tissue.
Yes, that's true.
So if we put a synthetic hyaluronic acid gel into a microscopic war zone of active inflammation, shouldn't those active enzymes just chew right through the filler we just injected?
If we connect this to the bigger picture, it is a highly logical concern. Because generalized inflammation absolutely degrades many types of temporary fillers.
Right.
But you have to look at the specific enzymes involved in this biological cascade. Hyaluronic acid is incredibly resilient against generalized inflammation.
Oh, really?
Yeah, it is dissolved by one highly specific enzyme called hyaluronidase.
Hyaluronidase. Oh, wait, that's the specific lock and key enzyme clinics keep on hand to melt away HA filler if an injection goes wrong in the face or lips, isn't it?
Yes, exactly. And while the alpha granules in PRP release a massive cascade of growth factors and initiate cellular remodeling, they do not contain hyaluronidase in high concentrations.
Okay, I see.
The PRP is focused on building tissue, not synthesizing the specific chemical key required to rapidly dissolve a cross-linked HA scaffold.
So the cross-linked ladder of the HA filler is essentially invisible to the PRP's demolition crew.
Exactly. The PRP simply works around it. So when administered on the same day, they don't fight.
That is fascinating.
The hyaluronic acid provides the immediate physical benefit. It bridges the gap, providing that architectural volume and friction, and it just undergoes its slow, elegant, isovolumetric degradation over 6 months.
And while that HA scaffold is holding the space for half a year, the PRP from the O-shot is just flooding the surrounding tissue with growth factors,
Right.
slowly building the permanent blood vessels, collagen, and nerve sensitivity.
It creates a beautiful synergistic protocol. By the time the G-shot filler has naturally degraded and the water is finally absorbed, the O-shot's new vascular networks and collagen matrix are fully established and mature.
Wow, so the temporary physical support hands the baton over to the permanent biological repair.
Precisely.
That answers the core question definitively. The chemistry allows them to coexist beautifully.
They really do.
But since we know they can be combined safely, we need to look at the clinical indications in the sources. Like, why would a patient choose one over the other if they aren't doing the combo?
Right. Let's talk about the specific applications and, honestly, more importantly, the limitations.
Yeah, we have to evaluate patient selection carefully.
Because these tools are incredibly precise, but they operate under strict biological rules.
Right. Looking at the data, the indications for a standalone G-shot are actually quite narrow.
Very narrow.
It's ideal for women who already know that G-spot stimulation works well for their specific anatomy, and they simply want a temporary physical enhancement for a specific event, or out of pure curiosity.
Yeah, it's an aesthetic volumetric enhancement. It does not treat underlying health issues.
All right. If you do not naturally have nerve sensitivity in that area, adding a physical filler is highly unlikely to spontaneously create an orgasmic response.
Exactly. It amplifies what is already there. It doesn't invent new neural pathways.
The O-shot, on the other hand, has a much broader clinical application because it's a regenerative tool.
Right.
The sources show it being utilized to treat painful intercourse, which is clinically known as dyspareunia.
Yes.
It treats a chronic lack of natural lubrication, decreased clitoral sensitivity, and it even addresses mild stress urinary incontinence by thickening and strengthening the connective tissue surrounding the urethra.
And this raises an important question because that breadth of application highlights why a thorough clinical evaluation is mandatory.
Mandatory, yeah.
The literature strongly emphasizes what these treatments cannot do. Like, neither the G-shot nor the O-shot is a cure for severe hormonal imbalances.
Right. The sources point out that PRP works optimally when the hormonal environment supports tissue regeneration.
Exactly.
If a patient is experiencing severe menopause-related estrogen depletion, the cellular environment is compromised.
You can't plant a garden in barren soil no matter how potent the seeds are.
That's a great way to put it. Injecting PRP locally might offer a temporary boost, but it is ultimately just treating a local symptom of a systemic hormonal issue.
Furthermore, neither procedure cures severe pelvic floor dysfunction or complex pain disorders like vulvodynia or vaginismus.
Right, those are systemic or structural issues.
Yeah. Women experiencing these conditions require comprehensive medical and often physical therapy assessments.
Because the clinical guides stress that an aesthetic or wellness injection should never be used to mask a deeper, treatable medical or anatomical condition.
You have to make sure the foundation of the house is stable before you start upgrading the living room.
So what does this all mean? Returning to the mission of this deep dive. For you, the listener, navigating this intersection of volume and regeneration, the data confirms that combining an HA G-shot and a PRP O-shot is chemically and physically sound science.
It absolutely is.
You can safely stack the immediate cross-linked architectural support of the G-shot with the long-term cellular regeneration of a PRP O-shot without the biology destroying the architecture.
Yeah, the cross-linked HA holds the structural space, immune to the PRP's growth factors, while the alpha granules rebuild the neighborhood around it.
It's incredible.
It really is. And stepping back from these specific procedures, this science reveals something profound about the future trajectory of medicine.
Oh, how so?
While the mechanism of the O-shot proves that our own blood, right now, circulating in our veins, contains the exact concentrated blueprints necessary to regenerate nerve sensitivity, build new vascular networks, and restore tissue function in our most intimately complex areas.
Which leaves you with a really fascinating reality to consider. If this autologous plasma can literally reverse cellular aging and restore lost function when it is simply isolated, concentrated, and redirected,
Right.
what other degenerative conditions in the human body are just sitting there, waiting for us to stop looking for external fixes and finally unlock the healing power of our own blood?
It's a huge frontier.
It really is. Well, thank you for exploring this deep dive with us. We will catch you on the next one.